Question 1. The monitoring system demonstrates that a significant number of patients receiving treatment for major depressive disorder are not achieving full remission with current standard pharmacotherapy. Considering the importance of research in psychiatric nursing, which of the following approaches best reflects a commitment to advancing patient care through evidence-based practice? Option A. Advocate for the adoption of treatments based on anecdotal success stories shared by colleagues, without independently verifying the underlying research evidence. Option B. Prioritize the integration of interventions and treatment modalities that have demonstrated efficacy through rigorous, peer-reviewed research and are supported by current clinical practice guidelines. Option C. Focus on implementing novel, experimental treatments that are gaining popularity in professional discussions, even if robust research supporting their long-term efficacy is limited. Option D. Continue with the established treatment protocols, relying primarily on the collective clinical experience of the nursing staff to manage patient care. The correct answer is B. Prioritize the integration of interventions and treatment modalities that have demonstrated efficacy through rigorous, peer-reviewed research and are supported by current clinical practice guidelines. Explanation: scenario analysis. This scenario presents a common challenge in psychiatric mental health nursing practice, where a PMHNP must integrate evidence-based interventions into daily patient care. The challenge lies in discerning the most effective and ethically sound approach when faced with varying levels of research support for different treatment modalities. The PMHNP must balance patient autonomy, therapeutic efficacy, and adherence to professional standards and regulatory guidelines. Correct approach analysis. The correct approach emphasizes the PMHNP responsibility to actively seek, critically appraise, and integrate current research findings into their clinical decision-making. This aligns with the core principles of evidence-based practice, which is a cornerstone of quality psychiatric mental health care. Regulatory frameworks and professional guidelines for PMHNP, such as those established by the American Nurses Association (ANA) and the American Psychiatric Nurses Association (EPNA), mandate the use of research to inform practice and improve patient outcomes. By prioritizing interventions supported by robust research, PMHNP ensures that patient care is not only effective, but also ethically sound, meeting the standard of care expected within the United States regulatory landscape for advanced practice registered nurses. This proactive engagement with research demonstrates a commitment to lifelong learning and professional accountability. Incorrect approaches analysis. One incorrect approach involves relying solely on personal clinical experience or anecdotal evidence. This fails to meet the standard of care because it neglects the systematic, empirical findings from research. Ethically, it can lead to suboptimal patient outcomes and potentially expose patients to interventions that are not proven effective or may even be harmful. Legally and regulatorily, it deviates from the expectation that advanced practice nurses utilize evidence-based practices, which are often implicitly or explicitly required by state boards of nursing and professional organizations. Another incorrect approach is to dismiss emerging research that challenges established practices without a thorough critical appraisal. This demonstrates a resistance to professional growth and can hinder the adoption of more effective treatments. Ethically, it may perpetuate the use of less effective interventions, thereby not acting in the best interest of the patient. Regulatory bodies expect nurses to stay abreast of advancements and to critically evaluate new evidence, not to ignore it. A third incorrect approach is to implement interventions based on popularity or anecdotal endorsements from colleagues without verifying the underlying research. This bypasses the essential step of critical evaluation and can lead to the widespread adoption of unproven or ineffective treatments. Professionally, it undermines the scientific basis of psychiatric nursing and can lead to inconsistent and potentially harmful patient care, violating the ethical obligation to provide competent and evidence-based care. Professional reasoning. The professional decision-making process for a PMHNP in this context should involve a systematic approach to evidence-based practice. This includes 1. Identifying a clinical question or problem. 2. Conducting a thorough literature search for relevant research. 3. Critically appraising the evidence for its validity, reliability, and applicability to the patient population. 4. Integrating the research findings with clinical expertise and patient values and preferences. 5. Evaluating the outcomes of the intervention and making adjustments as needed. This iterative process ensures that practice is informed by the best available evidence, promoting optimal patient care and adherence to professional and regulatory standards. Question 2. Quality control measures reveal a pattern where some PMHNP are consistently focusing their initial patient assessments primarily on symptom severity and potential pharmacological interventions, with less emphasis on exploring the patient's family dynamics, employment stressors, and past traumatic experiences. This approach, while addressing biological and immediate psychological distress, may overlook significant contributing factors to the patient's overall mental health and well-being. Which of the following assessment strategies best embodies a comprehensive biopsychosocial model approach for an initial psychiatric evaluation? Option A. A rapid assessment focused on identifying immediate safety risks and the most prominent biological symptoms to determine appropriate psychotropic medication. Option B. A detailed exploration of the patient's current mood and anxiety symptoms, with a secondary focus on their coping mechanisms and perceived social support network. Option C. A structured interview that systematically probes for biological symptoms, psychological distress, cognitive functioning, and social determinants of health, including family relationships, work environment, and history of trauma. Option D. A review of the patient's medical history and current medications, followed by a brief assessment of their primary complaint and its impact on daily functioning. The correct answer is C. A structured interview that systematically probes for biological symptoms, psychological distress, cognitive functioning, and social determinants of health, including family relationships, work environment, and history of trauma. Explanation. This scenario presents a professional challenge in accurately assessing a patient's complex presentation, requiring the PMHNP to move beyond a singular focus on biological symptoms to a holistic understanding. The biopsychosocial model is fundamental to psychiatric mental health nursing practice, emphasizing the interplay of biological, psychological, and social factors in health and illness. A failure to integrate all three domains can lead to incomplete diagnoses, ineffective treatment plans, and patient dissatisfaction. The correct approach involves a comprehensive assessment that actively seeks information across all three domains of the biopsychosocial model. This aligns with best practices in psychiatric care, which mandate a holistic view of the patient. By gathering data on biological factors, e.g., medical history, sleep patterns, diet, psychological factors, e.g., mood, cognition, coping mechanisms, past trauma, and social factors, e.g., family support, employment, financial stressors, cultural background, the PMHNP can develop a nuanced understanding of the patient's presenting problem. This comprehensive approach is ethically mandated by the principles of beneficence and non-maleficence, ensuring that the patient receives care that is both beneficial and avoids harm by addressing all contributing factors. It also aligns with professional standards of care that expect thorough patient evaluation. An incorrect approach that focuses solely on biological symptoms, such as prescribing medication without exploring psychological distress or social determinants of health, fails to acknowledge the multifaceted nature of mental illness. This can lead to a superficial understanding of the patient's needs, potentially resulting in treatment that is not only ineffective, but also overlooks critical contributing factors, thereby violating the principle of non-maleficence. Another incorrect approach that prioritizes psychological interventions while neglecting significant biological contributors, e.g., untreated medical conditions exacerbating psychiatric symptoms, or social stressors, e.g., homelessness impacting adherence, also represents a failure to adhere to the biopsychosocial model. This can lead to suboptimal outcomes and potentially harm the patient by not addressing all root causes. A third incorrect approach that solely addresses social issues without considering the biological and psychological components of the patient's distress would similarly be incomplete and potentially harmful, as it fails to recognize the interconnectedness of these domains. The professional decision-making process for similar situations should begin with a commitment to the biopsychosocial framework. When faced with a patient's presentation, the PMHNP should systematically consider 1. Biological factors. What medical conditions, genetic predispositions, or physiological changes might be contributing? 2. Psychological factors. What are the patient's thoughts, feelings, behaviors, coping strategies, and past experiences? 3. Social factors. What are the influences of the patient's environment, relationships, culture, and socioeconomic status? This structured inquiry ensures that all relevant domains are explored, leading to a more accurate diagnosis and a more effective, individualized treatment plan that respects the patient's overall well-being. Question 3. Which approach would be most appropriate for a PMHNP when a patient with a history of schizophrenia, currently experiencing a relapse with increased paranoia, expresses a strong desire to discontinue their antipsychotic medication, stating it makes them feel dull and uncreative, despite the PMHNP explanation of the medication's role in managing psychotic symptoms and preventing relapse? Option A. Persuade the patient to continue the current medication by emphasizing the severe consequences of relapse, overriding their concerns about feeling dull to ensure adherence. Option B. Immediately initiate involuntary commitment procedures due to the patient's history and current symptoms, as discontinuing medication poses a significant risk of relapse and harm. Option C. Respect the patient's stated desire to discontinue medication without further assessment, as patient autonomy is paramount in all treatment decisions. Option D. Conduct a thorough assessment of the patient's capacity to understand the risks and benefits of discontinuing medication, explore alternative medication options, or adjunctive therapies that might address their concerns about feeling dull, and document the assessment and any shared decision-making process. The correct answer is D. Conduct a thorough assessment of the patient's capacity to understand the risks and benefits of discontinuing medication, explore alternative medication options or adjunctive therapies that might address their concerns about feeling dull, and document the assessment and any shared decision-making process. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed desire for autonomy and the PMHNP ethical and legal duty to ensure patient safety, particularly when the patient's judgment may be impaired by their mental health condition. The PMHNP must balance respecting the patient's right to self-determination with the obligation to prevent harm, a core tenet of psychiatric mental health nursing practice. This requires a nuanced understanding of capacity assessment and the application of relevant ethical principles and regulatory guidelines. The correct approach prioritizes a thorough, objective assessment of the patient's capacity to make informed decisions regarding their treatment. This involves evaluating their ability to understand the information presented, appreciate the consequences of their choices, reason through the options, and communicate a choice. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, while also respecting autonomy to the extent possible. Regulatory frameworks, such as those governing mental health treatment in the U.S., e.g., state mental health laws, HIPAA, and professional nursing practice acts, emphasize the need for documented capacity assessments before overriding a patient's wishes, especially concerning involuntary treatment or significant treatment modifications. This approach ensures that any intervention is clinically justified, legally sound, and ethically defensible, protecting both the patient and the practitioner. An incorrect approach that immediately proceeds with involuntary hospitalization without a comprehensive capacity assessment fails to uphold the principle of autonomy and may violate the patient's rights. This could lead to legal challenges and ethical breaches, as involuntary commitment is a significant restriction of liberty that requires a high burden of proof regarding incapacitation and imminent danger. Another incorrect approach, which involves solely relying on the patient's stated wishes without considering the potential impact of their psychiatric condition on their decision-making capacity, neglects the PMHNP duty of care and the principle of beneficence. This could result in the patient making a decision that is detrimental to their well-being. Finally, an approach that involves pressuring the patient to agree to a specific treatment plan, rather than facilitating an informed decision-making process, undermines their autonomy and can erode the therapeutic alliance, potentially leading to non-adherence and a worsening of their condition. A professional decision-making process in such situations should involve a systematic evaluation. First, assessing the patient's capacity for the specific decision at hand. Second, if capacity is impaired, exploring less restrictive interventions and involving the patient in decision-making to the greatest extent possible. Third, if imminent risk of harm is present and capacity is lacking, initiating appropriate involuntary procedures with thorough documentation. And fourth, continuously reassessing capacity and treatment effectiveness. This process is guided by ethical codes, e.g., American Nurses Association Code of Ethics, and relevant legal statutes governing mental health care. Question 4. The review process indicates that a patient who has a history of suicide attempts and is currently experiencing significant depressive symptoms expresses a strong desire to keep their suicidal ideation private from their family, stating, "I don't want them to worry, and I can handle this on my own." The PMHNP is tasked with determining the most appropriate next step in managing this patient's risk. Option A. Conduct a thorough suicide risk assessment, exploring the patient's intent, plan, access to means, and protective factors, and collaboratively develop a safety plan that addresses their concerns about family involvement while ensuring their safety. Option B. Immediately initiate involuntary hospitalization based on the history of suicide attempts and current depressive symptoms, overriding the patient's wishes for privacy. Option C. Inform the patient's family of their suicidal ideation without the patient's consent, prioritizing family notification over patient confidentiality and autonomy. Option D. Respect the patient's stated desire for privacy and focus solely on outpatient therapy without involving family, assuming the patient is capable of self-management. The correct answer is D. Respect the patient's stated desire for privacy and focus solely on outpatient therapy without involving family, assuming the patient is capable of self-management. Explanation. This scenario presents a common yet critical challenge in psychiatric mental health nursing, balancing patient autonomy with the duty to protect from harm, specifically in the context of suicide risk. The professional challenge lies in accurately assessing the dynamic nature of suicidal ideation, identifying protective factors, and implementing an appropriate safety plan that respects the patient's wishes while mitigating immediate danger. The PMHNP must navigate the ethical imperative to do no harm, non-maleficence, and to promote well-being, beneficence, within the legal and regulatory framework governing mental health care. The correct approach prioritizes a comprehensive, collaborative, and evidence-based risk assessment. This involves actively engaging the patient in a discussion about their suicidal thoughts, intent, plan, and access to means, while simultaneously exploring protective factors such as social support, coping mechanisms, and reasons for living. The development of a safety plan should be a collaborative effort, empowering the patient and increasing their adherence. This approach aligns with best practices in suicide prevention, emphasizing patient-centered care and shared decision-making, which are foundational ethical principles and often reflected in state nurse practice acts and professional ethical codes. It also adheres to guidelines from organizations like the American Psychiatric Nurses Association, APNA, regarding suicide risk assessment and management. An incorrect approach would be to dismiss the patient's stated desire for privacy without a thorough risk assessment, as this fails to uphold the duty to protect. This could lead to a regulatory or ethical violation for failing to adequately assess and manage a known risk, potentially breaching standards of care. Another incorrect approach would be to impose a safety plan without patient buy-in or understanding. This undermines patient autonomy and is less likely to be effective, as the patient may not adhere to restrictions they feel were forced upon them. Ethically, this could be seen as paternalistic and a failure to respect the patient's right to self-determination, even when they are experiencing distress. Furthermore, relying solely on a standardized checklist without clinical judgment or patient engagement is insufficient. While checklists can be a tool, they are not a substitute for a nuanced clinical assessment that considers the individual's unique circumstances, history, and current presentation. This could lead to a failure to identify subtle but significant risk factors, constituting a breach of professional responsibility and potentially violating standards of care. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize and acknowledge the patient's expressed concerns. 2. Conduct a thorough, multifaceted risk assessment including ideation, intent, plan, means, and protective factors. 3. Engage the patient collaboratively in developing a safety plan, ensuring their understanding and agreement. 4. Document the assessment, interventions, and rationale meticulously. 5. Consult with supervisors or colleagues when uncertainty exists. 6. Continuously reevaluate risk and adjust the safety plan as needed. This process ensures that care is both clinically sound and ethically responsible, adhering to regulatory requirements and professional standards. Question 5. The analysis reveals a 35-year-old patient presenting with a history of impulsive decision-making, recurrent suicidal ideation with a recent suicide attempt, a pattern of unstable interpersonal relationships characterized by intense idealization and devaluation, and a tendency to exploit others for personal gain. The PMHNP is tasked with conducting a risk assessment to inform treatment planning. Which of the following approaches best prioritizes patient and public safety while adhering to professional standards of care? Option A. Focus primarily on the patient's reported feelings of emptiness and fear of abandonment, as these are central to their distress, and defer assessment of external risks until the therapeutic alliance is stronger. Option B. Conduct a comprehensive risk assessment that systematically evaluates the patient's history of self-harm, suicidal ideation, aggression, impulsivity, interpersonal exploitation, and disregard for rules, utilizing validated tools and collateral information where appropriate. Option C. Prioritize immediate de-escalation of the patient's emotional distress through supportive listening, without a formal, structured risk assessment, to build rapport before addressing potential safety concerns. Option D. Rely solely on the patient's self-report regarding their current intentions and capabilities, as direct questioning about aggressive or exploitative behaviors might damage the therapeutic relationship. The correct answer is B. Conduct a comprehensive risk assessment that systematically evaluates the patient's history of self-harm, suicidal ideation, aggression, impulsivity, interpersonal exploitation, and disregard for rules, utilizing validated tools and collateral information where appropriate. Explanation. The analysis reveals a complex clinical scenario involving a patient exhibiting traits consistent with personality disorders, specifically borderline, antisocial, and narcissistic personality disorders. The professional challenge lies in accurately assessing risk in the presence of overlapping and potentially escalating behaviors. A thorough risk assessment is paramount to ensure patient safety, public safety, and to guide appropriate treatment planning, adhering to the ethical and legal obligations of a PMHNP within the U.S. regulatory framework. This includes understanding the nuances of each disorder's typical risk profiles and how they might manifest in a clinical setting. The correct approach involves a comprehensive, multifaceted risk assessment that systematically evaluates the patient's history, current presentation, and potential for harm to self or others. This approach aligns with the American Nurses Association (ANA) Code of Ethics, which emphasizes the nurse's responsibility to protect patients and the public. It also aligns with the Nurse Practice Acts in various U.S. states, which mandate competent assessment and intervention. Specifically, a thorough risk assessment would consider suicidal ideation, self-harm behaviors, aggression, impulsivity, exploitation of others, and disregard for rules or safety, all of which are hallmarks of these personality disorders. The use of validated risk assessment tools, collateral information, and a thorough biopsychosocial evaluation are critical components. Incorrect approaches fail to adequately address the multifaceted nature of risk associated with these personality disorders, focusing solely on one aspect of risk, such as self-harm, while neglecting the potential for harm to others due to antisocial or narcissistic traits, represents a significant ethical and professional failing. This narrow focus could lead to inadequate safety planning and potential harm. Similarly, relying solely on the patient's self-report without corroboration or objective assessment is insufficient, as individuals with these disorders may manipulate or distort information. Failing to consult with supervisors or interdisciplinary teams when faced with complex risk assessment, especially when patient safety is a concern, violates the principle of seeking appropriate consultation and collaboration, which is a cornerstone of professional nursing practice and often implicitly or explicitly required by state boards of nursing. The professional decision-making process for similar situations should involve a structured approach. 1. Recognize the complexity of the presentation and the potential for multiple risk factors. 2. Initiate a comprehensive risk assessment, gathering information from multiple sources, patient, family/friends if appropriate, and consented previous records. 3. Utilize evidence-based assessment tools and clinical judgment. 4. Consider the interplay of different personality disorder traits and their impact on risk. 5. Consult with supervisors, colleagues, or interdisciplinary teams as needed, particularly when risk is high or uncertain. 6. Develop a safety plan that addresses all identified risks. 7. Document the assessment, interventions, and rationale thoroughly. Question 6. Stakeholder feedback indicates that a patient diagnosed with generalized anxiety disorder GAD expresses significant apprehension about starting psychotropic medication, citing past negative experiences and a preference for natural approaches. The patient is seeking a PMHNP for management of their GAD symptoms, which include persistent worry, restlessness, and difficulty concentrating. The PMHNP has assessed the patient and determined that a combination of pharmacotherapy and psychotherapy would be the most evidence-based and effective treatment approach. Which of the following represents the most appropriate initial approach for the PMHNP in this situation, adhering to U.S. regulatory frameworks and ethical guidelines for PMHNP practice? Option A. Proceed with the recommended pharmacotherapy without extensive discussion of alternatives, explaining to the patient that their anxiety symptoms require immediate medical intervention and that their apprehension is a symptom of the disorder itself. Option B. Acknowledge the patient's preference for natural approaches and immediately refer them to a naturopathic physician or other complementary medicine practitioner without further discussion of conventional treatment options. Option C. Prescribe the most appropriate psychotropic medication for GAD based on clinical guidelines, informing the patient that this is the standard of care and that non-compliance may necessitate referral to another provider. Option D. Initiate a detailed discussion with the patient about their specific concerns regarding medication. Explore their understanding of the benefits and risks of prescribed psychotropic medications, and collaboratively discuss evidence-based non-pharmacological interventions such as cognitive behavioral therapy, CBT, or mindfulness-based stress reduction as adjunctive or alternative treatment options. The correct answer is D. Initiate a detailed discussion with the patient about their specific concerns regarding medication. Explore their understanding of the benefits and risks of prescribed psychotropic medications, and collaboratively discuss evidence-based non-pharmacological interventions such as cognitive behavioral therapy, CBT, or mindfulness-based stress reduction as adjunctive or alternative treatment options. Explanation. This scenario presents a common implementation challenge in psychiatric mental health nursing practice, balancing patient-centered care with evidence-based treatment protocols, particularly when patient preferences diverge from recommended interventions for anxiety disorders. The challenge lies in respecting patient autonomy while ensuring the delivery of effective and safe care within the scope of practice and regulatory guidelines. The PMHNP must navigate potential communication barriers, assess the underlying reasons for patient resistance, and collaboratively develop a treatment plan that is both acceptable and beneficial. The correct approach represents best professional practice because it prioritizes a collaborative and patient-centered model of care, aligning with ethical principles of autonomy and beneficence. By engaging the patient in a discussion about their preferences and concerns regarding medication, the PMHNP demonstrates respect for their autonomy. Furthermore, exploring alternative or adjunctive non-pharmacological interventions, such as cognitive behavioral therapy, CBT, or mindfulness, acknowledges the multifaceted nature of anxiety disorders and offers evidence-based options that may be more palatable to the patient. This approach fosters therapeutic alliance, enhances treatment adherence, and ensures that the treatment plan is tailored to the individual's needs and values, all within the scope of PMHNP practice as defined by relevant U.S. federal and state regulations governing advanced practice registered nurses. An incorrect approach that focuses solely on prescribing medication without addressing the patient's expressed concerns or exploring alternatives fails to uphold the principle of patient autonomy. This could be seen as a violation of ethical standards and potentially a deviation from best practice guidelines that advocate for shared decision-making. Ethically, it disregards the patient's right to be informed and to participate in their treatment choices. Legally, depending on state nurse practice acts, it could be construed as practicing outside the bounds of informed consent. Another incorrect approach that dismisses the patient's concerns as simply resistance and proceeds with a standardized, non-negotiable treatment plan overlooks the importance of therapeutic rapport and individualized care. This approach risks alienating the patient, reducing engagement, and potentially leading to treatment non-adherence. It fails to recognize that patient preferences are valid and require exploration. Ethically, it can be seen as paternalistic and lacking in empathy. Regulatory frameworks for PMHNP emphasize the importance of a therapeutic relationship and patient-centered care, which this approach would undermine. A third incorrect approach that involves immediately referring the patient to another provider without attempting to understand or address their concerns is also professionally problematic. While referrals are sometimes necessary, doing so solely based on initial patient preference without a thorough assessment and collaborative problem-solving can be seen as an abdication of responsibility. It fails to fully utilize the PMHNP expertise in managing anxiety disorders and building therapeutic relationships. Ethically, it may not be the most beneficence-driven action if the PMHNP could have potentially resolved the issue through further discussion and exploration of options. The professional decision-making process for similar situations should involve 1. Active listening and empathetic validation of the patient's concerns and preferences. 2. Comprehensive assessment of the anxiety disorder, including its impact on the patient's life and their understanding of treatment options. 3. Collaborative exploration of all available evidence-based treatment modalities, including pharmacological and non-pharmacological interventions, discussing the risks, benefits, and alternatives of each. 4. Joint development of a treatment plan that respects patient autonomy while aligning with professional standards and regulatory requirements. 5. Ongoing evaluation and adjustment of the treatment plan based on patient response and evolving needs. Question 7. System analysis indicates a 35-year-old patient presence with persistent low mood, anhedonia, significant fatigue, and difficulty concentrating for the past 6 months. They also report occasional auditory hallucinations, described as vague whispers, which they attribute to stress. The patient denies any history of mania or hypomania, but their family history is significant for bipolar disorder. The PMHNP-BC is tasked with determining the most appropriate initial diagnostic classification. Which of the following approaches best reflects the required diagnostic process according to the DSM-5-TR and best professional practice for a PMHNP-BC in the United States? Option A. Conduct a thorough differential diagnosis, considering major depressive disorder, persistent depressive disorder, bipolar disorder depressive episode, and schizoaffective disorder depressive type by systematically evaluating the presence and interplay of all diagnostic criteria, including the nature and context of the auditory hallucinations and family history. Option B. Immediately diagnose the patient with major depressive disorder, recurrent, severe, given the prominent depressive symptoms and duration, while noting the auditory hallucinations as a specifier for depression. Option C. Classify the patient's presentation as unspecified depressive disorder due to the presence of both depressive symptoms and hallucinations, and recommend immediate referral to a psychiatrist for further evaluation without initiating any preliminary treatment. Option D. Focus solely on the auditory hallucinations as the primary symptom, initiating treatment for a psychotic disorder and deferring further assessment of mood symptoms until the psychosis is stabilized. The correct answer is B. Immediately diagnose the patient with major depressive disorder, recurrent, severe, given the prominent depressive symptoms and duration, while noting the auditory hallucinations as a specifier for depression. Explanation. This scenario presents a common clinical challenge in psychiatric mental health nursing, where the presentation of symptoms can overlap across multiple diagnostic categories, requiring a nuanced understanding of diagnostic criteria and the ability to differentiate based on subtle but significant distinctions. The challenge lies in accurately classifying a patient's presentation to ensure appropriate treatment planning and to avoid misdiagnosis, which can lead to ineffective or even harmful interventions. The PMHNP-BC must apply their knowledge of diagnostic frameworks, such as the DSM-5-TR, to systematically evaluate the patient's symptoms, history, and functional impairment. Correct approach involves a comprehensive assessment that prioritizes gathering detailed information about the onset, duration, severity, and impact of the patient's symptoms, as well as ruling out other potential causes or co-occurring conditions. This aligns with best professional practice as outlined by the American Nurses Association (ANA), Standards of Practice, and the American Psychiatric Nurses Association (EPNA), Standards of Psychiatric Mental Health Nursing Practice, which emphasize the importance of accurate assessment and diagnosis as the foundation for evidence-based care. Specifically, the diagnostic process requires adherence to established classification systems like the DSM-5-TR, ensuring that diagnoses are made based on a thorough evaluation of the criteria. An incorrect approach would be to make a presumptive diagnosis based on a single prominent symptom or a superficial understanding of the patient's presentation. This fails to acknowledge the complexity of mental health disorders and the potential for symptom overlap. For instance, attributing all symptoms solely to a mood disorder without considering the possibility of a psychotic disorder or a personality disorder would be a significant diagnostic error. Such an approach violates the ethical principle of beneficence by potentially delaying or misdirecting treatment, and it fails to uphold the professional standard of care, which demands a rigorous and systematic diagnostic process. Another incorrect approach would be to rely solely on patient self-report without objective observation or collateral information, as this can lead to incomplete or biased diagnostic conclusions. This neglects the professional responsibility to conduct a thorough and multifaceted assessment. The professional decision-making process for similar situations should involve a systematic approach. 1. Initiate a comprehensive biopsychosocial spiritual assessment, gathering data from multiple sources including patient interview, observation, and potentially collateral information. 2. Review the patient's presenting symptoms against the diagnostic criteria of the DSM-5-TR, considering differential diagnoses. 3. Explore the temporal relationship of symptoms, their impact on functioning, and any precipitating or exacerbating factors. 4. Rule out medical conditions that could mimic psychiatric symptoms through appropriate screening or consultation. 5. Formulate a differential diagnosis, ranking the most likely conditions. 6. Develop a treatment plan that is responsive to the most probable diagnosis, while remaining flexible to adjust as new information emerges or the patient's response to treatment is observed. 7. Document the assessment findings, diagnostic reasoning, and treatment plan meticulously. Question 8. During the evaluation of a patient with a history of opioid use disorder and current symptoms of severe depression, which of the following psychotropic medication selection strategies best aligns with current evidence-based practice and regulatory guidelines for PMHNP? Option A. Initiate treatment with a high-potency antipsychotic to address potential psychotic features that may emerge due to the stress of managing both conditions. Option B. Focus exclusively on non-pharmacological interventions such as psychotherapy and mindfulness, deferring all psychotropic medication until the substance use disorder is in complete remission. Option C. Prioritize medications with a lower risk of diversion and abuse, carefully considering their efficacy for depression and potential interactions with any current or past substance use, while developing a collaborative treatment plan with the patient. Option D. Prescribe a benzodiazepine to manage anxiety associated with withdrawal, as this is a common co-occurring symptom in patients with substance use disorders. The correct answer is C. Prioritize medications with a lower risk of diversion and abuse, carefully considering their efficacy for depression and potential interactions with any current or past substance use, while developing a collaborative treatment plan with the patient. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a PMHNP must navigate the complexities of psychotropic medication management for a patient with a co-occurring mental health and substance use disorder. The challenge lies in balancing the need to treat the primary psychiatric condition with the potential for exacerbating or interfering with the substance use disorder, all while adhering to evidence-based practice and regulatory guidelines. The PMHNP must consider the pharmacodynamics and pharmacokinetics of various medications, potential drug interactions, and the patient's individual response and risk factors. Correct approach analysis. The correct approach involves a comprehensive assessment that includes a detailed history of substance use, current medications, allergies, and previous treatment responses. This is followed by the selection of a psychotropic medication with a favorable safety profile in the context of substance use, considering its mechanism of action and potential for misuse or diversion. The PMHNP must also develop a collaborative treatment plan with the patient, emphasizing education about the medication, potential side effects, and the importance of adherence and open communication regarding substance use. This aligns with the American Nurses Association ANA Code of Ethics, which emphasizes patient advocacy, beneficence, and non-maleficence, and the American Psychiatric Nurses Association APNA guidelines for PMHNP, which stress the importance of a holistic, patient-centered approach to medication management, particularly in complex cases. Incorrect approach is analysis. One incorrect approach involves prescribing a psychotropic medication known for its high potential for abuse or diversion without adequate safeguards or consideration of alternative treatments. This violates the principle of non-maleficence by increasing the risk of harm to the patient through potential misuse or exacerbation of their substance use disorder. It also fails to adhere to best practices in addiction psychiatry and may contravene state and federal regulations regarding controlled substances. Another incorrect approach is to solely focus on treating the psychiatric symptoms without acknowledging or addressing the co-occurring substance use disorder. This is a fragmented approach that neglects the interconnectedness of mental health and addiction, potentially leading to treatment failure, relapse, and harm. It demonstrates a lack of comprehensive assessment and a failure to provide holistic care as mandated by nursing standards of practice. A third incorrect approach is to avoid prescribing any psychotropic medication due to the co-occurring substance use disorder, opting instead for non-pharmacological interventions alone, even when pharmacotherapy is indicated for the psychiatric condition. While non-pharmacological interventions are crucial, withholding necessary medication can lead to worsening psychiatric symptoms, functional impairment, and increased distress for the patient, potentially hindering their ability to engage in substance use treatment. This can be seen as a failure to provide appropriate and timely care, potentially violating the duty to treat. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough biopsychosocial assessment. This includes understanding the patient's presenting problem, their history of mental illness and substance use, their current social and environmental context, and their personal goals. Next, the PMHNP should consult evidence-based guidelines and literature specific to treating co-occurring disorders. They should then consider the risks and benefits of various treatment options, prioritizing those with a favorable safety profile and lower potential for misuse. Collaboration with the patient, their family, if appropriate, and other healthcare providers is essential. Finally, ongoing monitoring and evaluation of the patient's response to treatment, including any changes in psychiatric symptoms or substance use, are critical for adjusting the treatment plan as needed. Question 9. The efficiency study reveals that a PMHNP is evaluating a 5-year-old child presenting with significant challenges in social interaction and repetitive behaviors, alongside marked inattention and hyperactivity. The PMHNP must determine the most appropriate initial diagnostic and assessment strategy. Option A. Initiate immediate behavioral interventions targeting hyperactivity and impulsivity based on parental reports, deferring a formal diagnostic assessment until the child is older. Option B. Focus primarily on behavioral checklists completed by parents and teachers to identify the most prominent symptoms of inattention and hyperactivity, assuming these are the primary drivers of the child's difficulties. Option C. Rely solely on the child's ability to engage in imaginative play and verbal communication to rule out autism spectrum disorder. Then proceed with a standard ADHD assessment. Option D. Conduct a comprehensive developmental history. Administer the Autism Diagnostic Observation Schedule, 2nd edition, ADUS 2, and the Connors 3 rating scales, and observe the child's behavior in a structured play setting. The correct answer is D. Conduct a comprehensive developmental history, administer the Autism Diagnostic Observation Schedule, 2nd edition, ADUS 2, and the Connors 3 rating scales, and observe the child's behavior in a structured play setting. Explanation. This scenario presents a common challenge in psychiatric mental health nursing practice, differentiating between the core features of autism spectrum disorder (ASD) and attention deficit/hyperactivity disorder (ADHD), especially when symptoms overlap and present in a young child. The professional challenge lies in accurately diagnosing and developing an effective, individualized treatment plan that addresses the child's unique needs without misattributing symptoms or overlooking critical diagnostic criteria. This requires a deep understanding of both conditions, their diagnostic guidelines, and the potential for co-occurrence. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment that adheres to established diagnostic criteria and best practice guidelines for neurodevelopmental disorders. This includes gathering information from multiple sources, parents, teachers, direct observation, utilizing standardized assessment tools, and considering the developmental trajectory of the child's symptoms. This systematic approach ensures that the diagnosis is based on robust evidence, minimizing the risk of misdiagnosis and leading to more targeted and effective interventions. It aligns with the ethical obligation to provide competent and evidence-based care, as well as regulatory requirements for accurate diagnosis and treatment planning. An incorrect approach that relies solely on parental report, without objective observation or standardized tools, fails to meet the standard of care. This could lead to a diagnosis based on subjective interpretation rather than objective evidence, potentially resulting in inappropriate treatment and missed opportunities for early intervention. Ethically, this is a failure of due diligence and competence. Another incorrect approach that focuses only on managing overt behavioral issues without exploring the underlying neurodevelopmental underpinnings neglects the core diagnostic requirements for ASD and ADHD. This approach risks treating symptoms rather than the disorder, which is both ethically and regulatorily unsound, as it does not address the root cause of the child's difficulties. Finally, an approach that prematurely labels the child based on a single symptom or observation, without a thorough differential diagnosis, violates the principles of accurate assessment and can lead to significant harm through misdiagnosis and ineffective or even detrimental interventions. The professional decision-making process for similar situations should involve a systematic approach. 1. Elicit a detailed history from all available informants, focusing on the onset, duration, and pervasiveness of symptoms across different settings. 2. Conduct direct behavioral observations of the child in various contexts, if possible. 3. Utilize validated, age-appropriate screening and diagnostic instruments for both ADHD and ASD. 4. Perform a thorough differential diagnosis, considering other potential conditions that may mimic or co-occur with ADHD and ASD. 5. Consult with other professionals, e.g., developmental pediatricians, psychologists when necessary. 6. Develop an individualized treatment plan based on the confirmed diagnosis and the child's specific strengths and challenges, ensuring ongoing monitoring and adjustment of interventions. Question 10. Governance review demonstrates that a 45-year-old patient diagnosed with bipolar I disorder, currently maintained on lithium 900 mg daily, presents to the clinic reporting increased irritability, pressured speech, decreased need for sleep, 3 hours per night for the past week, and impulsive spending. The patient has a history of inconsistent medication adherence. The PMHNP is considering the next steps in managing this acute manic episode. Which of the following approaches best aligns with current evidence-based practice and regulatory guidelines for PMHNP in managing this situation? Option A. Increase the lithium dose to 1,200 mg daily and monitor for therapeutic response and potential toxicity. Option B. Switch from lithium to lamotrigine, titrating slowly as per standard protocol. Option C. Discontinue lithium and initiate valproic acid at a therapeutic dose. Option D. Augment lithium therapy with an atypical antipsychotic, titrating cautiously and monitoring for efficacy and side effects. The correct answer is D. Augment lithium therapy with an atypical antipsychotic, titrating cautiously and monitoring for efficacy and side effects. Explanation. Scenario analysis. This scenario presents a common clinical challenge involving a patient with bipolar disorder experiencing a breakthrough manic episode while on maintenance therapy with a mood stabilizer. The challenge lies in balancing the need for rapid symptom control with the potential risks and side effects of escalating medication, particularly in a patient with a history of non-adherence. The PMHNP must consider the patient's current presentation, past treatment responses, and potential drug interactions, all while adhering to established clinical guidelines and regulatory requirements for medication management. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current symptoms, including their severity, duration, and impact on functioning. This assessment should inform a decision to augment the existing lithium therapy with an atypical antipsychotic, which is a well-established strategy for managing acute mania in patients already on a mood stabilizer. This approach is supported by evidence-based guidelines for bipolar disorder management, which recommend combination therapy for severe manic episodes. It prioritizes patient safety by titrating the new medication cautiously and monitoring for adverse effects, while also addressing the immediate clinical need for symptom stabilization. This aligns with the PMHNP ethical and professional responsibility to provide evidence-based, patient-centered care. Incorrect approaches analysis. Initiating a higher dose of lithium without considering augmentation is problematic because it may not provide sufficient rapid control of acute mania and could increase the risk of lithium toxicity, especially in a patient with potential adherence issues. This approach fails to consider the most effective and evidence-based strategies for acute manic exacerbations. Switching to a different anticonvulsant mood stabilizer without addressing the current manic symptoms is also inappropriate. While anticonvulsants are used for bipolar disorder, abruptly changing medication without managing the acute episode can lead to prolonged suffering and increased risk of harm. Furthermore, the rationale for switching without a clear indication of lithium intolerance or ineffectiveness for acute mania is questionable. Discontinuing lithium and initiating a new mood stabilizer without a clear clinical rationale or a plan for managing the acute manic symptoms is a significant departure from best practice. This approach risks destabilizing the patient further and could be interpreted as a failure to provide adequate and timely treatment for a serious mental health condition. It also overlooks the established efficacy of lithium as a first-line mood stabilizer. Professional reasoning. When faced with a patient experiencing a breakthrough manic episode while on maintenance mood stabilizer therapy, the PMHNP should follow a systematic decision-making process. This involves 1. Thoroughly assessing the patient's current clinical status, including symptom severity, functional impairment, and any contributing factors. 2. Reviewing the patient's medication history, including adherence patterns, previous treatment responses, and any known side effects. 3. Consulting current evidence-based clinical practice guidelines for the management of bipolar disorder, specifically acute mania. 4. Considering pharmacologic options that are supported by evidence for rapid symptom control and augmentation strategies. 5. Developing a treatment plan that prioritizes patient safety, efficacy, and adherence, with clear monitoring parameters for both therapeutic response and adverse effects. 6. Documenting the rationale for all treatment decisions and communicating the plan clearly to the patient and any involved caregivers. Question 11. Regulatory review indicates that a 35-year-old patient presents with recurrent intrusive memories of a traumatic event that occurred 6 months ago, accompanied by significant distress when exposed to reminders of the event, and a marked avoidance of thoughts and feelings associated with it. The patient also reports hypervigilance and difficulty concentrating. The PMHNP is tasked with developing an initial treatment plan. Which of the following approaches best aligns with current U.S. regulatory frameworks and evidence-based practice for managing potential trauma and stress-related disorders? Option A. Advise the patient that these symptoms are a normal reaction to a stressful event and recommend relaxation techniques without further diagnostic evaluation. Option B. Focus solely on managing the hypervigilance and concentration difficulties with stimulant medication. As these are the most disruptive symptoms, Option C. Prescribe a high dose of a benzodiazepine to immediately alleviate the patient's anxiety and intrusive thoughts, with a follow-up appointment scheduled in 3 months. Option D. Initiate a course of trauma-focused psychotherapy, such as trauma-focused cognitive behavioral therapy, TFCBT, while closely monitoring for symptom improvement and considering pharmacotherapy as an adjunct if indicated and within the PMHNP prescriptive authority. Correct answer is D. Initiate a course of trauma-focused psychotherapy, such as trauma-focused cognitive behavioral therapy, TFCBT, while closely monitoring for symptom improvement and considering pharmacotherapy as an adjunct if indicated and within the PMHNP prescriptive authority. Explanation. This scenario presents a professional challenge due to the sensitive nature of trauma, the potential for re-traumatization, and the ethical imperative to provide evidence-based care within the scope of practice for a PMHNP. The patient's history of childhood abuse and current presentation of intrusive memories and avoidance behaviors strongly suggest a trauma-related disorder, requiring a nuanced and informed approach. Careful judgment is essential to ensure patient safety, promote therapeutic alliance, and adhere to professional standards of care. The correct approach represents best professional practice because it aligns with established guidelines for treating trauma and stress-related disorders, specifically PTSD and acute stress disorder, as outlined by relevant U.S. federal and state regulations governing mental health practice and the American Nurses Association ANA Code of Ethics. This approach prioritizes a comprehensive assessment to confirm diagnosis, rule out comorbidity, and understand the patient's unique trauma history and its impact. It emphasizes the use of evidence-based psychotherapies, such as trauma-focused cognitive behavioral therapy, TFCBT, or eye movement desensitization and reprocessing (EMDR), which are recognized for their efficacy in treating PTSD. Furthermore, it includes a plan for ongoing monitoring, psychoeducation, and the judicious use of pharmacotherapy, if indicated, and within the PMHNP prescriptive authority, all while maintaining patient autonomy and informed consent. This holistic and evidence-informed strategy ensures the patient receives safe, effective, and ethical care. An incorrect approach that involves immediately prescribing a high dose of an anxiolytic without a thorough assessment fails to adhere to regulatory requirements for diagnostic accuracy and evidence-based treatment. This could lead to masking symptoms, developing dependence, and neglecting the underlying trauma, potentially exacerbating the patient's distress and hindering long-term recovery. Ethically, it violates the principle of non-maleficence by risking harm and the principle of beneficence by not providing the most appropriate care. Another incorrect approach, such as solely focusing on symptom management through medication without addressing the root cause of the trauma, also falls short. While pharmacotherapy can be a component of treatment, it is generally not considered the primary intervention for PTSD and can be ineffective or even detrimental if not integrated into a broader therapeutic plan. This approach neglects the core elements of trauma processing and recovery, potentially leading to chronic symptom burden and a failure to achieve meaningful improvement. It also risks violating professional standards that mandate comprehensive, individualized treatment plans. A third incorrect approach, which involves dismissing the patient's symptoms as a normal reaction to stress without further investigation, is a significant ethical and regulatory failure. This demonstrates a lack of professional diligence and could lead to a misdiagnosis of a serious mental health condition like PTSD or acute stress disorder. Such a failure to assess and diagnose appropriately can result in delayed or absent treatment, causing prolonged suffering for the patient and potentially violating the duty of care owed to them. It also disregards the established diagnostic criteria and assessment protocols mandated by professional nursing practice. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough biopsychosocial spiritual assessment, including a detailed trauma history and mental status examination, to establish an accurate diagnosis and identify co-occurring conditions. 2. Consult relevant diagnostic criteria, e.g., DSM-5-TR, and evidence-based treatment guidelines for trauma-related disorders. 3. Develop an individualized treatment plan collaboratively with the patient, incorporating evidence-based psychotherapies and considering pharmacotherapy as an adjunct if appropriate and within the PMHNP scope of practice. 4. Prioritize patient safety, informed consent, and the therapeutic alliance throughout the treatment process. 5. Continuously monitor patient progress, reassess the treatment plan as needed, and seek consultation or referral when indicated. 6. Adhere strictly to all applicable federal and state regulations governing PMHNP practice, including prescriptive authority and documentation requirements. Question 12. The audit findings indicate a pattern of inconsistent application of evidence-based psychopharmacological guidelines in the management of patients with treatment-resistant depression. Specifically, the review highlights a tendency to rely on older, less effective medication combinations rather than exploring newer therapeutic options supported by current research. Considering the PMHNPBC's role in optimizing patient outcomes and adhering to regulatory standards, which of the following approaches best addresses this audit finding? Option A. Initiate a comprehensive review of the patient population's current medication regimens, cross-referencing with the latest evidence-based treatment algorithms for treatment-resistant depression and relevant professional practice guidelines, followed by individualized treatment plan adjustments based on this comparative analysis and patient-specific factors. Option B. Prioritize patient requests for specific medications, even if they are not the first-line treatments recommended by current guidelines, to ensure patient satisfaction and adherence. Option C. Continue with the established medication protocols as they have been historically effective for a significant portion of the patient population, assuming the audit findings represent outliers rather than a systemic issue. Option D. Immediately discontinue all current medications for patients identified in the audit as having treatment-resistant depression and await further guidance before initiating new treatments. The correct answer is A. Initiate a comprehensive review of the patient population's current medication regimens, cross-referencing with the latest evidence-based treatment algorithms for treatment-resistant depression and relevant professional practice guidelines, followed by individualized treatment plan adjustments based on this comparative analysis and patient-specific factors. Explanation: the audit findings highlight a common challenge in psychiatric mental health nursing practice, ensuring adherence to evidence-based guidelines and regulatory requirements when managing complex psychopharmacological regimens. This scenario is professionally challenging because it requires the PMHNP to critically evaluate current practice against established standards, identify potential deviations, and implement corrective actions that prioritize patient safety and therapeutic efficacy. Need for comparative analysis of different pharmacological approaches underscores the dynamic nature of psychiatric pharmacotherapy and the importance of continuous professional development. The correct approach represents best professional practice because it involves a systematic, evidence-based evaluation of the patient's current medication regimen. This aligns with the core principles of patient-centered care and the PMHNP responsibility to provide safe, effective, and individualized treatment. Specifically, it adheres to the American Nurses Association ANA Code of Ethics, which mandates that nurses practice with compassion and respect, and that they advocate for their patients. Furthermore, it aligns with the standards of practice for psychiatric mental health nurse practitioners, which emphasize the use of current research and best practices in medication management. This approach ensures that treatment decisions are informed by the latest scientific evidence and are tailored to the patient's unique needs and response, thereby minimizing risks and maximizing benefits. An incorrect approach that involves continuing the current regimen without further assessment fails to uphold the PMHNP duty of care. This could be considered a breach of professional responsibility and potentially violate the Nurse Practice Act of the jurisdiction, which requires practitioners to maintain competence and provide care within their scope of practice. It neglects the principle of beneficence by not actively seeking to optimize patient outcomes and could lead to continued suboptimal treatment or adverse effects. Another incorrect approach, such as abruptly discontinuing a medication without a clear clinical rationale or transition plan, poses significant risks to the patient. This could lead to withdrawal symptoms, relapse of psychiatric symptoms, or destabilization of the patient's condition, directly contravening the ethical principle of non-maleficence, do no harm. Such an action would likely be considered negligent and fall outside the accepted standards of psychiatric nursing practice. A further incorrect approach, focusing solely on patient preference without considering clinical evidence or potential risks, also represents a failure in professional judgment. While patient autonomy is crucial, the PMHNP has a professional and ethical obligation to guide patients toward treatments that are both effective and safe, based on their clinical expertise and current scientific understanding. Ignoring evidence-based recommendations in favor of patient preference alone can lead to suboptimal care and potential harm. The professional decision-making process for similar situations should involve a structured approach. First, critically review the audit findings and identify the specific area of concern. Second, consult relevant evidence-based guidelines, professional standards, and regulatory requirements. Third, conduct a thorough patient assessment to gather all necessary clinical data. Fourth, engage in a collaborative decision-making process with the patient, incorporating their preferences and values while providing expert guidance. Finally, document all assessments, decisions, and interventions meticulously, ensuring transparency and accountability. Question 13. The risk matrix shows a patient experiencing acute psychosis, exhibiting paranoia and auditory hallucinations, and expressing fear of being harmed. The PMHNP needs to assess the patient's immediate safety and gather information for treatment. Which of the following communication approaches best aligns with the principles of therapeutic communication and ethical practice for a certified psychiatric mental health nurse practitioner, PMHNP/BC, in this situation? Option A. Minimize the patient's expressed fears by focusing solely on objective symptoms and offering immediate solutions without exploring their emotional state. Option B. Directly challenge the patient's hallucinations, stating clearly that they are not real and that the patient is mistaken, to help them regain touch with reality. Option C. Share personal anecdotes about similar experiences to build rapport and demonstrate understanding of what the patient is going through. Option D. Acknowledge the patient's fear and distress. Validate their feelings without necessarily agreeing with the content of their hallucinations, and use gentle, open-ended questions to explore their experience and needs. The correct answer is D. Acknowledge the patient's fear and distress. Validate their feelings without necessarily agreeing with the content of their hallucinations, and use gentle, open-ended questions to explore their experience and needs. Explanation. This scenario presents a professional challenge due to the inherent vulnerability of a patient experiencing acute psychosis and the critical need for a PMHNP to establish trust and safety while gathering essential information. The PMHNP must navigate the patient's altered reality and potential paranoia without invalidating their experience or escalating distress. Careful judgment is required to select communication strategies that are both therapeutic and ethically sound, adhering to the principles of patient-centered care and professional boundaries. The correct approach represents best professional practice because it prioritizes empathy, validation, and a non-judgmental stance. By reflecting the patient's feelings and acknowledging their distress, the PMHNP creates a safe space for communication. Using open-ended questions and offering choices empowers the patient and respects their autonomy, even within the context of their illness. This aligns with the American Nurses Association ANA Code of Ethics for Nurses, which emphasizes the importance of therapeutic relationships, respect for human dignity, and the nurse's role in advocating for the patient's well-being. Specifically, Provision 1. 2. Respect for autonomy and Provision 1. 5. Nurturing wholeness are directly addressed by this approach. An incorrect approach that involves directly confronting the patient's delusions or attempting to reason them out of their altered perception fails to acknowledge the nature of psychosis. This can lead to increased agitation, mistrust, and a breakdown in the therapeutic alliance, potentially violating the ethical principle of non-maleficence, do no harm, by causing psychological distress. Such an approach also disregards the patient's subjective reality, which is a core component of therapeutic engagement in psychiatric care. Another incorrect approach that involves dismissing the patient's concerns or becoming overly directive without first establishing rapport can alienate the patient. This can be perceived as a lack of empathy and understanding, hindering the collection of vital information necessary for assessment and treatment planning. Ethically, this could be seen as a failure to provide competent care, as effective communication is fundamental to the PMHNP role. A further incorrect approach that involves sharing personal opinions or experiences unrelated to the patient's care can blur professional boundaries and undermine the PMHNP credibility. This violates the ethical standard of maintaining professional boundaries and can lead to a compromised therapeutic relationship, impacting the patient's trust and willingness to engage in treatment. The professional decision-making process for similar situations should involve a continuous assessment of the patient's state, an understanding of the principles of therapeutic communication, and a commitment to ethical practice. The PMHNP should first aim to establish a safe and trusting environment, then use active listening and empathetic responses to understand the patient's perspective, and finally, employ communication techniques that are tailored to the patient's current mental state and needs, always prioritizing their dignity and well-being. Question 14. Implementation of a psychiatric mental health assessment for a patient from a collectivist culture who expresses distress through somatic complaints and family obligations. What approach best integrates cultural considerations for accurate diagnosis and treatment planning? Option A. Directly challenge the patient's focus on somatic complaints and family duties, explaining that these are not primary indicators of mental illness according to Western diagnostic criteria. Option B. Prioritize understanding the patient's perception of their illness within their cultural context, exploring how family roles and community support influence their well-being, and collaboratively developing interventions that respect these factors. Option C. Administer a standardized depression screening tool and focus solely on the reported psychological symptoms, assuming universal presentation of mental health conditions. Option D. Rely exclusively on the patient's verbalized emotional distress, disregarding somatic complaints and cultural explanations as secondary to the core psychiatric symptoms. The correct answer is B. Prioritize understanding the patient's perception of their illness within their cultural context, exploring how family roles and community support influence their well-being, and collaboratively developing interventions that respect these factors. Explanation. The scenario presents a common challenge in psychiatric mental health nursing, conducting a comprehensive assessment while navigating diverse cultural backgrounds that can significantly influence how symptoms are expressed, understood, and reported. The PMHNP must balance the need for standardized assessment tools with the imperative to respect and incorporate the patient's cultural framework. This requires a nuanced approach that avoids ethnocentrism and promotes culturally sensitive care, aligning with ethical principles of beneficence, non-maleficence, and respect for autonomy. The correct approach demonstrates best professional practice by prioritizing a patient-centered, culturally humble assessment. This involves actively seeking to understand the patient's worldview, including their beliefs about mental health, illness causation, and preferred healing practices. This aligns with the American Nurses Association ANA Code of Ethics, which emphasizes the nurse's responsibility to provide care that is respectful of the patient's values, beliefs, and preferences. Furthermore, it adheres to the standards of practice for PMHNP, which mandate culturally competent care. By integrating cultural context into the assessment, the PMHNP can achieve a more accurate diagnosis, develop a more effective and acceptable treatment plan, and build a stronger therapeutic alliance. An incorrect approach that relies solely on a standardized, culturally decontextualized assessment tool fails to acknowledge the impact of culture on symptom presentation and interpretation. This can lead to misdiagnosis, underestimation of symptom severity, or the imposition of a treatment plan that is incompatible with the patient's cultural beliefs, potentially causing harm and violating the principle of non-maleficence. Another incorrect approach that dismisses or minimizes the patient's cultural explanations for their distress, instead imposing a biomedical model without exploration, demonstrates a lack of cultural humility and respect for the patient's lived experience, potentially alienating the patient and hindering engagement in care. This can be seen as a failure to uphold the ethical obligation to respect patient autonomy and dignity. Professionals should employ a decision-making process that begins with self-reflection on their own cultural biases. This is followed by actively eliciting the patient's cultural narrative, asking open-ended questions about their beliefs, values, and experiences related to their current concerns. The PMHNP should then integrate this cultural information with clinical findings, using it to inform the interpretation of symptoms and the development of a collaborative treatment plan. This iterative process ensures that care is both clinically sound and culturally congruent. Question 15. The assessment process reveals a patient who has been diagnosed with recurrent major depressive disorder and has a history of impulsive suicidal ideation in the past, expresses a strong desire to discontinue their prescribed antidepressant medication. The patient states they feel fine now and believe they no longer need the medication, citing a desire to take control of my own life. The patient appears articulate and coherent during the session. What is the most appropriate initial approach for the PMHNP? Option A. Explore the patient's reasons for wanting to discontinue medication, validate their feelings of wanting autonomy, and collaboratively discuss the potential risks and benefits of stopping, alongside alternative coping strategies and support systems. Option B. Dismiss the patient's desire to stop medication as a symptom of their underlying depression and focus solely on reinforcing the importance of adherence to the current treatment plan. Option C. Immediately inform the patient that discontinuing the medication is not advisable due to their history and mandate that they continue taking it to prevent relapse or further impulsive behavior. Option D. Contact the patient's family to inform them of the patient's wishes and request their assistance in ensuring the patient continues their medication, without further discussion with the patient about alternatives. The correct answer is A. Explore the patient's reasons for wanting to discontinue medication, validate their feelings of wanting autonomy, and collaboratively discuss the potential risks and benefits of stopping, alongside alternative coping strategies and support systems. Explanation. This scenario presents a professional challenge because the PMHNP must balance the patient's expressed desire for autonomy and self-determination, central to humanistic theory, with the ethical and legal obligations to ensure patient safety and well-being. The patient's history of impulsive behavior and potential for self-harm introduces a conflict between respecting their current wishes and intervening to prevent foreseeable harm. Careful judgment is required to navigate this delicate balance, ensuring that interventions are least restrictive while still protective. The correct approach represents best professional practice because it prioritizes a collaborative and patient-centered approach, aligning with humanistic principles of unconditional positive regard and empathy. By actively listening to the patient's concerns, validating their feelings, and exploring their motivations for discontinuing medication, the PMHNP demonstrates respect for their autonomy. The subsequent exploration of potential risks and benefits, coupled with a discussion of alternative coping strategies and support systems, empowers the patient to make an informed decision. This approach adheres to ethical guidelines that mandate informed consent and shared decision-making, while also fulfilling the professional duty to assess and manage risk. The focus remains on empowering the patient to find their own solutions and build resilience, rather than imposing a solution. An incorrect approach that involves immediately overriding the patient's wishes and mandating continued medication without further exploration fails to respect the patient's autonomy and self-determination, core tenets of humanistic theory. This approach could erode trust and lead to patient disengagement from care, potentially increasing risk. It also disregards the principle of least restrictive intervention. Another incorrect approach that involves dismissing the patient's concerns as irrational or a symptom of their illness, without attempting to understand their perspective, demonstrates a lack of empathy and unconditional positive regard. This devalues the patient's lived experience and can be perceived as judgmental, hindering therapeutic alliance. It also fails to explore the underlying reasons for their desire to stop medication, which may be valid from the patient's viewpoint. A further incorrect approach that involves unilaterally contacting family members or external agencies without the patient's explicit consent, unless there is an immediate and imminent threat of harm that cannot be managed otherwise, violates patient confidentiality and autonomy. While safety is paramount, such actions should be a last resort after exhausting less intrusive options, and should ideally involve the patient in the decision-making process regarding information sharing. The professional decision-making process for similar situations involves a systematic approach. First, actively listen and empathetically understand the patient's perspective and concerns. Second, assess the patient's capacity to make informed decisions. Third, collaboratively explore the risks and benefits of proposed actions, including the patient's stated wishes and potential consequences. Fourth, identify and discuss alternative strategies and support systems. Fifth, document all assessments, discussions, and decisions thoroughly. Finally, consult with supervisors or colleagues when faced with complex ethical or clinical dilemmas. The guiding principle is to empower the patient while ensuring their safety through the least restrictive means necessary. Question 16. Process analysis reveals a 22-year-old patient diagnosed with anorexia nervosa, presenting with a BMI of 15, 5, bradycardia, and electrolyte imbalances. The patient adamantly refuses hospitalization, stating they feel fine and do not want to be confined. As the certified psychiatric mental health nurse practitioner, PMHNP, what is the most appropriate immediate course of action to ensure patient safety while respecting their autonomy as much as possible within the regulatory framework? Option A. Discharge the patient from care with instructions to return if their condition worsens, as they are an adult and have the right to refuse treatment. Option B. Conduct a thorough medical risk assessment in collaboration with the patient's primary care physician. Develop a detailed safety plan for outpatient management with clear criteria for escalation to higher levels of care, and provide extensive education to the patient and their support system regarding the risks of continued refusal of hospitalization. Option C. Focus solely on psychotherapy interventions in the outpatient setting, assuming the patient will eventually agree to hospitalization if their condition deteriorates significantly. Option D. Immediately initiate involuntary commitment proceedings based on the patient's low BMI and vital sign abnormalities, overriding their refusal of hospitalization to ensure their immediate safety. The correct answer is B. Conduct a thorough medical risk assessment in collaboration with the patient's primary care physician. Develop a detailed safety plan for outpatient management with clear criteria for escalation to higher levels of care, and provide extensive education to the patient and their support system regarding the risks of continued refusal of hospitalization. Explanation. This scenario presents a professional challenge due to the complex interplay of physical health, psychological distress, and potential legal/ethical considerations inherent in managing eating disorders. The PMHNP must navigate the patient's resistance to treatment, the severity of their physical condition, and the need for a multidisciplinary approach, all while adhering to the scope of practice and ethical guidelines for PMHNP in the United States, as governed by the American Nurses Association (ANA) Code of Ethics and relevant state nurse practice acts. The patient's refusal of hospitalization, despite significant medical instability, creates an ethical dilemma requiring careful balancing of patient autonomy with the duty to prevent harm. The correct approach represents best professional practice because it prioritizes patient safety and well-being through a comprehensive, collaborative, and evidence-based intervention. This involves a thorough risk assessment, including the immediate medical dangers posed by the eating disorder, and a structured plan to engage the patient in higher levels of care when medically indicated. It aligns with the ANA Code of Ethics, which emphasizes the nurse's responsibility to advocate for patients, promote their health and safety, and provide care within the scope of their practice. Collaboration with a multidisciplinary team, physicians, dietitians, therapists, is crucial for holistic treatment and is a standard of care for eating disorders. Documenting the assessment, the patient's refusal, the rationale for recommendations, and the plan for ongoing monitoring is essential for legal and ethical accountability. An incorrect approach that focuses solely on outpatient therapy without a robust medical risk assessment and a clear plan for escalation of care fails to adequately address the immediate life-threatening risks associated with severe malnutrition. This could be considered a breach of the nursing duty to protect the patient from harm, potentially violating state nurse practice acts that mandate reporting or intervention when a patient's health is in jeopardy. Another incorrect approach that involves overriding the patient's autonomy without clear legal or ethical justification for involuntary commitment would be a violation of patient rights. The decision for involuntary commitment is a complex legal process with strict criteria that must be met, and a PMHNP role is to assess and recommend, not unilaterally decide. A third incorrect approach that involves discharging the patient without a safety plan or referral to a higher level of care when medically unstable would also represent a failure to uphold the duty of care and could have severe consequences for the patient. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment of the patient's physical and mental health status, including a thorough risk assessment for immediate harm. 2. Identification of the patient's expressed wishes and understanding of their condition, while also considering their capacity to make decisions. 3. Consultation with a multidisciplinary team to gather diverse perspectives and develop a coordinated treatment plan. 4. Application of ethical principles, particularly beneficence acting in the patient's best interest, non-maleficence, avoiding harm, autonomy, respecting the patient's right to self-determination, and justice fairness in treatment. 5. Adherence to legal statutes and professional standards of practice, including documentation of all assessments, interventions, and communications. 6. Development of a clear plan for ongoing monitoring and escalation of care as needed. Question 17. Market research demonstrates a growing demand for effective and safe anxiolytic treatments. A 45-year-old patient presents with persistent feelings of worry, restlessness, difficulty concentrating, and muscle tension for the past 6 months, significantly impacting their work and social life. The patient has no significant past medical history, denies substance abuse, and has no prior psychiatric treatment. The patient expresses a desire for immediate relief from their distressing symptoms. As a certified psychiatric mental health nurse practitioner, PMHNP, which of the following initial pharmacotherapeutic approaches would be most appropriate for this patient? Option A. Prescribe a short-acting benzodiazepine for immediate symptom relief to be taken as needed. Option B. Recommend a trial of herbal supplements known for their calming properties, with no pharmacotherapy initiated at this time. Option C. Start aripiprazole, an atypical antipsychotic, to address the patient's anxiety symptoms. Option D. Initiate a selective serotonin reuptake inhibitor (SRI) and provide comprehensive education on its mechanism, expected onset of action, and management of potential side effects. The correct answer is D. Initiate a selective serotonin reuptake inhibitor (SRI) and provide comprehensive education on its mechanism, expected onset of action, and management of potential side effects. Explanation. This scenario presents a common clinical challenge involving the initiation of anxiolytic medication for a patient experiencing significant anxiety symptoms. The professional challenge lies in balancing the immediate need for symptom relief with the long-term management of anxiety, potential for dependence, and adherence to evidence-based practice and regulatory guidelines for psychotropic medication prescribing. Careful judgment is required to select the most appropriate initial pharmacotherapy, considering the patient's presentation, medical history, and risk factors. The correct approach represents best professional practice by prioritizing a non-benzodiazepine anxiolytic with a favorable safety profile for initial treatment of generalized anxiety disorder. This aligns with current clinical guidelines and regulatory frameworks that advocate for first-line treatment with selective serotonin reuptake inhibitors, SRI, or serotonin norepinephrine reuptake inhibitors, SNRI, for chronic anxiety disorders due to their efficacy in addressing underlying neurobiological mechanisms and lower risk of dependence compared to benzodiazepines. The PMHNP role includes patient education on the medication's mechanism of action, expected onset of therapeutic effects, potential side effects, and the importance of adherence for optimal outcomes. This approach adheres to the principles of patient-centered care, informed consent, and evidence-based practice, as mandated by professional nursing standards and state/federal regulations governing advanced practice registered nurses. An incorrect approach would involve immediately prescribing a benzodiazepine for generalized anxiety disorder without a clear indication for short-term as needed use or acute exacerbation. This fails to adhere to the principle of least restrictive intervention and can lead to significant risks, including tolerance, dependence, withdrawal symptoms, cognitive impairment, and increased risk of falls, particularly in vulnerable populations. Regulatory frameworks and professional guidelines strongly caution against the long-term use of benzodiazepines for chronic anxiety due to these risks. Prescribing a benzodiazepine as a first-line, long-term treatment would represent a deviation from best practice and potentially violate prescribing regulations that emphasize careful risk-benefit assessment and consideration of alternative therapies. Another incorrect approach would be to solely rely on non-pharmacological interventions without addressing the patient's acute distress and functional impairment. Non-pharmacological approaches are crucial components of anxiety management. They may not provide sufficient immediate relief for severe symptoms. Failing to offer pharmacotherapy when indicated, especially when the patient's functional capacity is significantly compromised, could be considered a failure to provide comprehensive care and may not align with the PMHNP duty to alleviate suffering and improve patient outcomes. This could also be viewed as a failure to adhere to the collaborative practice agreement or scope of practice guidelines, depending on the specific state regulations. A third incorrect approach would be to prescribe a medication without adequate patient education regarding its use, expected effects, and potential side effects. This failure to obtain informed consent and ensure patient understanding undermines patient autonomy and adherence, increasing the risk of adverse events and suboptimal treatment outcomes. Regulatory bodies and professional organizations emphasize the importance of thorough patient education as a cornerstone of safe and effective medication management. The professional decision-making process for similar situations should involve a systematic assessment of the patient's symptoms, functional impairment, medical history, and psychosocial factors. This assessment should guide the selection of pharmacotherapy based on evidence-based guidelines, considering the specific anxiety disorder diagnosis. A thorough risk-benefit analysis for each potential medication class is essential. Patient preferences and values should be incorporated into the decision-making process, and comprehensive education regarding the chosen treatment, including its rationale, expected outcomes, potential side effects, and alternatives, must be provided. Ongoing monitoring for efficacy and adverse effects, along with regular reassessment of the treatment plan, is critical for optimal patient care and adherence to regulatory requirements. Question 18. Investigation of a 45-year-old male patient diagnosed with schizophrenia reveals he has been experiencing persistent auditory hallucinations and disorganized thinking, despite adequate trials of haloperidol and chlorpromazine, both administered at therapeutic doses. He reports significant sedation, dry mouth, and blurred vision with these medications, which he finds distressing and disruptive to his daily activities. The patient expresses a desire for a medication that is more tolerable and effective. What is the most appropriate next step in managing this patient's psychiatric condition? Option A. Switch to another typical antipsychotic such as flufenazine with a similar side effect profile. Option B. Increase the dosage of chlorpromazine to the maximum recommended level, despite the patient's reported side effects. Option C. Discontinue all antipsychotic medication due to the patient's reported side effects and lack of efficacy. Option D. Initiate treatment with clozapine after a thorough assessment for contraindications and establishing a plan for regular blood monitoring. The correct answer is D. Initiate treatment with clozapine after a thorough assessment for contraindications and establishing a plan for regular blood monitoring. Explanation. This scenario presents a common clinical challenge in psychiatric mental health nursing practice. Managing a patient with treatment-resistant schizophrenia who has experienced significant side effects from typical antipsychotics. The challenge lies in balancing the need for effective symptom management with the imperative to minimize adverse drug reactions, all while adhering to established clinical guidelines and ethical principles. The PMHNP must navigate the complexities of psychopharmacology, patient history, and individual patient response to medication. The correct approach represents best professional practice because it prioritizes a patient-centered, evidence-based strategy. Switching to an atypical antipsychotic, particularly clozapine, is a well-established and often necessary intervention for treatment-resistant schizophrenia. This decision is supported by numerous clinical guidelines and research, which indicate that atypical antipsychotics, while still carrying risks, often have a different side effect profile and can be more effective in cases where typical agents have failed or caused intolerable adverse events. The process involves a thorough assessment, informed consent, careful monitoring for efficacy and side effects, including regular blood work for clozapine, and a collaborative approach with the patient. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and autonomy, respecting the patient's right to make informed decisions. An incorrect approach would be to discontinue all antipsychotic medication without a clear plan for alternative management. This would likely lead to a relapse of psychotic symptoms, significantly impairing the patient's functioning and well-being, and potentially posing a risk to themselves or others. Failure to provide adequate care would violate the principle of beneficence and could be considered professional negligence. Another incorrect approach would be to simply increase the dose of the current typical antipsychotic. This ignores the patient's reported side effects and the documented lack of efficacy, potentially exacerbating adverse reactions without improving outcomes. This demonstrates a failure to adequately assess the patient's response and a disregard for the principle of non-maleficence. A further incorrect approach might be to switch to another typical antipsychotic with a similar mechanism of action and side effect profile. This would be unlikely to yield different results and would fail to address the core issue of intolerable side effects and lack of efficacy, representing a failure in clinical judgment and evidence-based practice. The professional decision-making process for similar situations should involve a systematic assessment of the patient's current presentation, including symptom severity and functional status. A thorough review of past medication trials, including efficacy, side effects, and adherence, is crucial. Consultation with current clinical practice guidelines for schizophrenia management is essential. The PMHNP must then consider the available pharmacological option, weighing the potential benefits against the risks and side effect profiles of each. Patient preferences and values must be integrated into the decision-making process, ensuring informed consent. A collaborative approach with the patient, and potentially their family or support system, is paramount. Finally, a robust plan for monitoring efficacy and adverse events must be established and implemented. Question 19. What factors determine the most accurate and comprehensive assessment of psychopathology in a psychiatric mental health nurse-practitioner-patient relationship, considering the multifaceted nature of mental illness within the United States regulatory framework? Option A. The application of generalized cultural norms and expectations to interpret the patient's symptoms and behaviors. Option B. The primary focus on the patient's subjective description of their experiences, without corroborating evidence or professional observation. Option C. The integration of biological, psychological, social, and spiritual influences on the patient's presentation, alongside objective assessment data and patient self-report. Option D. The exclusive reliance on genetic predispositions and neurochemical imbalances identified through laboratory testing. The correct answer is C. The integration of biological, psychological, social, and spiritual influences on the patient's presentation, alongside objective assessment data and patient self-report. Explanation. This scenario is professionally challenging because the PMHNP must navigate the complex interplay of biological, psychological, and social factors that contribute to psychopathology, while adhering to the strict ethical and legal standards governing psychiatric mental health practice in the United States. The assessment of psychopathology requires a nuanced understanding of diagnostic criteria, individual presentation, and the impact of various influences on mental well-being. Careful judgment is required to differentiate between normal developmental variations, situational distress, and clinical disorders, ensuring accurate diagnosis and appropriate treatment planning. The correct approach represents best professional practice because it emphasizes a comprehensive, holistic assessment that integrates multiple domains of influence. This aligns with the American Nurses Association (ANA) Standards of Practice and the American Psychiatric Nurses Association (APNA) Standards of Psychiatric Mental Health Nursing Practice, which mandate thorough assessment, diagnosis, outcome identification, planning, implementation, and evaluation. Specifically, it reflects the ethical principle of beneficence by ensuring that all relevant factors are considered to provide the most effective and individualized care. It also adheres to the legal requirement of providing care within the scope of practice, which necessitates understanding the multifaceted nature of mental illness. An incorrect approach that focuses solely on biological markers would fail to acknowledge the significant impact of environmental stressors, trauma, and interpersonal relationships on mental health, potentially leading to an incomplete or inaccurate diagnosis and treatment plan. This would violate the ethical principle of non-maleficence by risking harm through inadequate care. It would also be considered a failure to meet the standards of practice, which require a biopsychosocial spiritual approach, an approach that prioritizes only the patient's self-report without objective assessment or consideration of collateral information could lead to misdiagnosis, especially in cases where insight is impaired or symptoms are subtle. This neglects the professional responsibility to conduct a thorough and objective evaluation, potentially leading to inappropriate interventions and failing to uphold the standard of care. An approach that relies exclusively on cultural stereotypes would be ethically and legally problematic, violating principles of justice and respect for individual dignity. It would also be a failure to adhere to the ANA Code of Ethics, which emphasizes providing culturally congruent care and avoiding bias. Such an approach would lead to discriminatory practices and ineffective treatment. The professional decision-making process for similar situations should involve a systematic, evidence-based approach. This includes 1. Gathering comprehensive data from multiple sources, patient interview, observation, collateral information, standardized assessments. 2. Analyzing the data through the lens of established diagnostic criteria, DSM-5TR, and theoretical frameworks. 3. Considering the biopsychosocial spiritual context of the individual. 4. Differentiating between potential diagnoses. 5. Developing a collaborative treatment plan that addresses identified needs and goals, while continuously evaluating its effectiveness and making adjustments as necessary. This process ensures that care is patient-centered, ethical, and legally compliant within the U.S. regulatory framework. Question 20. When evaluating a patient presenting with escalating agitation and active suicidal ideation, which theoretical framework would best guide a comprehensive risk assessment and the development of an immediate safety plan? Option A. A purely behavioral theoretical framework emphasizing observable behaviors and environmental stimuli without exploring internal experiences. Option B. A purely cognitive theoretical framework focusing solely on identifying and correcting distorted thought patterns without considering emotional or social context. Option C. A purely psychodynamic theoretical framework focusing exclusively on exploring early childhood experiences and unconscious conflicts. Option D. A biopsychosocial theoretical framework that integrates biological, psychological, and social factors influencing the patient's current state. The correct answer is D. A biopsychosocial theoretical framework that integrates biological, psychological, and social factors influencing the patient's current state. Explanation. This scenario presents a professional challenge because the PMHNP must integrate theoretical frameworks with the practical realities of risk assessment, ensuring patient safety while respecting autonomy. The challenge lies in selecting the most appropriate theoretical lens to guide the assessment of a patient exhibiting escalating agitation and suicidal ideation, a situation demanding immediate and effective intervention. The correct approach represents best professional practice because it directly aligns with the core tenets of psychiatric nursing theory, particularly those emphasizing a holistic understanding of the patient's experience and the therapeutic relationship. Theories that focus on the interplay of biological, psychological, and social factors, biopsychosocial model, provide a comprehensive framework for understanding the multifaceted nature of mental illness and risk. This approach allows for a thorough assessment of contributing factors, enabling the PMHNP to develop a tailored and effective safety plan. It also supports the ethical imperative to provide patient-centered care, respecting the individual's unique circumstances and promoting their active participation in treatment. This aligns with the American Nurses Association, ANA, Code of Ethics for Nurses, which emphasizes the nurse's responsibility to promote health, prevent illness, and advocate for patients. An incorrect approach that relies solely on a psychodynamic framework without considering immediate safety concerns would be professionally unacceptable. While psychodynamic theories offer valuable insights into underlying conflicts, an exclusive focus on exploring past traumas or unconscious drives in an acute crisis situation could delay necessary interventions for immediate safety, potentially violating the ethical duty to protect the patient from harm. This could be seen as a failure to adhere to the principle of beneficence and non-maleficence. Another incorrect approach that prioritizes a purely behavioral perspective, focusing only on observable behaviors and immediate environmental triggers without exploring the patient's subjective experience or underlying cognitive distortions, would also be professionally unacceptable. This narrow focus might lead to superficial interventions that do not address the root causes of the patient's distress or suicidal ideation, potentially failing to establish a robust safety plan. This could represent a failure to provide comprehensive care as mandated by professional standards. The professional decision-making process for similar situations involves a systematic approach. First, ensuring immediate safety through appropriate de-escalation and risk mitigation strategies. Second, conducting a thorough biopsychosocial assessment, drawing upon relevant theoretical frameworks to understand the patient's presentation. Third, collaboratively developing a safety plan that addresses identified risks and incorporates patient preferences. And finally, documenting the assessment, interventions, and plan meticulously, adhering to all relevant legal and ethical guidelines.